Hello everybody, happy Friday. It's been a minute since I've done one of these, so I will give anybody a minute to hop on. I know this one is a little unorthodox because it is later in the day. Typically we do these around noon, or we try, but I was treating all day. So I'm on here a little bit later now that I'm ready to wrap the day up. And thankfully it's a nice Friday. So I'll keep this one, brief for anybody who wants to catch it later. I'm just gonna be talking a little bit about referred pain, what referred pain is and what it means. It's a question that we get often, and it's something that I don't think I've seen talked about recently. So hopefully this can answer some questions. Now, usually when we're treating, people will often describe how an injury happened or what type of pain they started getting first, and then somewhere along the conversation or the evaluation comes, well, if the problem is here, why do I feel it there? Or vice versa. And, the answer is most often because of referred pain. So I will say this typically happens most frequently with the spine, especially in the neck. Some of those trigger points that are in the upper traps and the cervical paraspinals, hey Jenna, can cause referred pain, especially throughout the head and the face. So referred pain, by definition, is pain that is felt elsewhere within the body despite where the problematic tissue is. So there's a number of reasons why this can happen. The first being that the problem is pinching on a nerve. So as is often the case with the spine, if you have a disc injury or a soft tissue injury that's pinching on a nerve within your cervical tract or your lumbar tract, then most often people do get symptoms either down the arms if the neck is involved, or down your legs if your low back is involved. And that is a type of referred pain. It has a name. It's called radiculopathy. And when we treat somebody with those issues, the goal is to bring the pain back up. So out of the periphery, out of the hands, the arms, the legs, and back up into the focal area, which would be the spine. Now, that's not the only area or the only cause of why people can have referred pain. Another is trigger points. So when somebody gets a trigger point or gets a knot in one of their muscles, if it's a fairly new one or an active trigger point, you've probably heard us say, when we press on it, it's not unheard of for you to get pain elsewhere in the body. Case in point is the upper traps. So we all at some point have probably had a trigger point in the upper traps, or, close to one. Everybody has a lot of upper trap tension, and a lot of people will describe getting headaches, or on the side, say your left one is what's involved, people will get pain that comes up and around the side of their head, sometimes into their forehead or into their eyes. The reason that happens is because muscles don't just isolate to one area of the body. So your upper trap actually does attach to the base of your skull. It has a wide attachment that does come kind of right behind the ear, and then it comes down and it attaches out here on that lateral shoulder. And then likewise, your upper trap sits very, very close to other muscles. So it sits very close to your cervical paraspinals, which sit very close to the temporalis muscle. And then there's two other parts to the trapezius, which is the middle trap and the low trap, which runs down along your shoulder blade and your back. So when one muscle becomes dysfunctional, such as having a trigger point in it, it oftentimes is not going to be the only soft tissue that is affected, which is why sometimes those symptoms manifest elsewhere. And I know it's a weird phenomena. A lot of people get kind of the heebie-jeebies about it, especially when we poke somewhere and they feel it, behind their eye or something like that. But your body really truly is a chain, and everything is connected. Now, the last reason why people do sometimes get referred pain, well, actually, no, there is really two more reasons. One is more therapeutic though, so I'll give you that one first. And that is because of the fascia within the body. So you've probably heard Jen and I talk about fascia a lot. It is that sticky, thin material that sits between the layer of your skin and then your muscles, tendons, ligaments. It overlays everything. It's basically like a big sheeted spider web. When that becomes adhesed or becomes bound down, the whole tract of that fascia is going to be affected. So say you get an abdominal surgery and you obviously are going to have a scar. Underneath the scar, that fascia right in that area becomes affected. Well, that's your abdominal fascia, and it actually extends well above and below that area. So it's not unheard of when you have a restriction in the fascia, if we pull and are trying to release that area, you can feel that pain or those sensations elsewhere where that fascia also lies. Now, the last reason sometimes for referred pain is actually because of organ systems. And this is an important one to know because certain organ systems will cause pain in the area that they're in, but you may not actually perceive it as being something, like an organ. So a lot of people, the most common one that I would say people frequently know is the heart. A lot of people know that if they're having something like shortness of breath with shoulder pain or left arm pain, that it can be their heart, it can be a heart attack. But what a lot of people don't know is that referred pain from the abdominal organs actually sometimes or most often is in the back. Sometimes if it's the liver or the stomach, it can be the chest, or it could be in between the shoulder blades. If it's something like your appendix or a kidney, those can be felt in that lower back area. We call it the saddle area, sometimes even into the hip and thigh. So you always want to be cautious when you're experiencing pain, and especially if there is referred pain. But the good thing is that your physical therapist here can tell you if it's something that is muscular, neural, or an organ system. It's something we test for frequently when we do evaluations. But yeah, I thought that was a fun, brief little topic, something that we hear about a lot with referred pain and just an easygoing topic for this Friday. So I hope that was informative, and I hope everybody has a great weekend.